Welcome to the Golden Jubilee National Hospital. As an NHS Scotland National Board, we are very proud and extremely privileged to be home to a major orthopaedic centre of excellence, to a growing and significant ophthalmic unit, and to one of the largest heart and lung centres in the UK.
2013-14 was a very challenging but very successful year for us. We started the year intending to treat 23,500 patients. As we went through the year, we were asked to increase our orthopaedic, ophthalmology and MRI programmes. We increased those services as we went through the year, and as a result exceeded our full year plan by 14.7%. This means that we treated 3,500 more patients than we intended at the beginning of the year. We're looking to establish outreach clinics for a number of boards, and at this point in time we've already committed to 3 outreach clinics.
Yeah, well, it's been an extremely busy year for us. We are at the moment expanding the service. We have a 500% increase in the amount of work that we're being asked to do compared with 2011, 2012. So at the moment we're innovating in terms of how we utilise staff, how we spread the staff out throughout a department. Well, moving forward, first we are going to expand the outpatient department to cope with the huge increase in the number of patients that we're being asked to see over the next 2 years.
Our HEI agenda is very clearly set out within the planned programme for the prevention and control of infection, and we met our targets, we met our programme for last year. We work very closely with the local teams to look at their data and build and improve and sustain improvement. We use infection data, but because our infection rates are so low, we tend to focus more on compliance data because we focus more on prevention. So we use the kind of data in terms of national patient safety, standard infection control precautions data, and also hand hygiene data. So we'll continue to work with the Scottish Patient Safety Programme, we'll continue to look at standard infection control precautions and also the implementation of the National Manual and Transmission-Based Precautions.
I am very pleased to report that the board has achieved all of its 3 key financial targets for the year 2013-14. It's been a very challenging but very interesting year. In terms of numbers, we generated efficiency savings of approximately 3.6 million against a target of 2.6 million. We absolutely continue to deliver quality improvements across the organisation, working within a very tight financial envelope.
We've carried out a number of energy initiatives over the years. We've just started on a decentralisation programme, the intention of which is to remove the steam infrastructure and replace it with low temp hot water. And this in itself will save perhaps 15% annually on gas consumption, and it will have a very positive impact on our carbon footprint. Now, we are looking at a number of innovative solutions, one of which is to take advantage of the fact that we're so close to the Clyde and possibly install a water-sourced heat pump.
Our board's 2020 vision is to lead quality research and innovation, and to do that on behalf of our board here, but importantly on behalf of NHS Scotland. 3 distinct elements, all of them equally important. We believe only to be taken forward in parallel, and they are all interdependent. You can't do one without the other. So the first of those elements, governance. Governance for quality. The second element, our workforce, but not just any workforce, a values-based workforce. You should be able to walk into any department or ward and see it. If you're a patient and you're in for care, every contact, every part of that care process, you should feel it. And when I wake up in the morning, a member of staff, heading to work, I should believe it. So the third element are quality indicators. So we reviewed all of the quality indicators, made sure that each of them could have a measure against safe, effective and person-centred, and that they added value to our organisation and the safety of our patients. Safety is never compromised.
The thing that I did really notice was that the staff are extremely happy, and that also is to do with the environment of the hospital. I mean, you've got this beautiful scenery here as well, which helps a lot. And I was asking a young chap today, I says, do you enjoy working here at the hospital? He says, I love it. And that is really nice to hear, because that doesn't, that reflects back on the patients. If your staff are happy, the patients are happy.
I came into the Jubilee with cardiac arrest while playing football. I then went to Dumfries Infirmary and got transferred up here to get an ICD fitted. The staff have been great at the Golden Jubilee. Everyone's been really accommodating. They've been trying to help me through it mentally as well as physically. All the nurses are very helpful. They come in and check me periodically. I couldn't complain, everything's great.
And as part of the National Care Programme, we have focused our work on making some improvements. One of them is with a review of our quality patient and public group. Part of that work has been around reviewing that the role and responsibilities for that group does indeed help us to ensure that we get the best use for our patients and for service users.
Our Board Diversity Champion programme was first launched in 2012 and it's proven really successful. And following a recent evaluation, we've actually added to our champion role now, and that's totalling 30 champions. And they play a vital role in helping to promote our equality and diversity work at their own department level.
We were delighted to be given the opportunity to be one of the pilot boards for the NHS Scotland Staff Experience Programme, and in fact over 300 of our staff in 18 teams actually was involved in developing the national programme, and we're going to be one of the early adopters in terms of the iMatters implementation rollout plan later this year. In terms of team effectiveness, we were successful in securing a bid from the Scottish Government and the Dignity at Work funding, whereby we will be able to do a lot of work to look at how we can support teams and enhancing team effectiveness.
Our reputation and communicating with patients and members of the public is vitally important, and that's why I'm really pleased that last year 97% of the people that we interacted with had a positive experience. And that's a positive experience through things such as social media, the media itself, patient opinion, our website and emails.
The Beardmore Centre for Health Science has two main components. It's got the clinical research facility and it's got the clinical skills facility. So the clinical skills facility is a suite of purpose-built educational rooms that includes a simulator room, facilities for doing wet labs, and most importantly perhaps the facility to make live links with theatres, cath labs and radiology so that we can watch live patient demonstrations, and that includes a two-way audio link which allows interactive use of these. So if we think a bit about management of adverse incidents always occur in all systems. And the important thing is to learn from them and to feed that learning into continuous improvement. And we've done a lot of work looking at our own processes so that they're lined up with the national framework for HIS. We've reviewed our risk management processes this year, and that started up with a top-down approach. So we reviewed the board risk register, looking at our actual risks and our processes for handling risk. And then the audit committee will continue to take that work forwards during the course of this year.
So over the past year, the research activity has continued to focus on finding new ways to improve recovery after heart attack and also after heart bypass surgery, and also to look at enhanced recovery after the type of major orthopaedic surgery that goes on at the Golden Jubilee. This thing that will happen over the next couple of years is that we have taken on a sponsor role for a major multi-centre European study looking at a new type of coronary stent for patients who have lesions, narrowings in the main heart arteries.
Well, this is the Beardmore Hotel and Conference Centre, and we're a very integral part of NHS Scotland, and we work very closely with the Golden Jubilee Hospital. We have about 52% of our customers are from the NHS, public sector or the third sector. We do have roughly about 43,000 delegates a year, mainly, as I say, NHS Scotland public sector.
We've had a fantastic 12 months, including an improvement in our GTBS green accreditation, where we were re-evaluated and achieved our gold status, but also with an improved score, so we improved to 86%. In addition to that, we also had the inclusion of car charging points.
The Beardmore 2020 strategy was an extensive piece of work to identify an optimal future for the Hotel and Conference Centre as an integral part of the National Waiting Time Centre. It was decided that our strategy would be to be the hospitality and conferencing element of a board-wide strategy to create an innovative centre of excellence for healthcare and medicine.
This is our brand new innovation centre. It's to encourage innovation, it's to provide a high-tech environment that inspires staff to have new ideas. Innovation is us supporting you to take your idea into improving patient care. And we would hope that this brand new centre provides that link to our hospital, to our research centre and to the hotel here for the benefit of all our patients. It's also vitally important for us to share this innovation resource and our skills and expertise across the whole of Scotland, and indeed that's exactly what this centre is for.